Certificate 3 in Pathology. Introduction to Pathology Collecting. Duty of care, duties of a collector, the professional relationship with the patient. What is pathology? Pathology is the first link in the chain that leads to a diagnosis. When a patient goes to their GP, they present with a range of symptoms, and from those symptoms, the doctor will conclude that there may be several causes for their problem. There will be pathology tests ordered to monitor the organs that could be causing the problem, and depending on the results of the test, a diagnosis can be made. Pathology is the study of the origin of the disease or complaint. It's an accurate science. There's no room for mistakes. Near enough is not good enough. Everything we do must be exact. All those who work in pathology must be professional and skilled at their job. Every level of the practice is just as important as the rest. If a courier doesn't pick up the samples on time or store them adequately, they will be of no use to test. If the collector doesn't mix a tube correctly, the testing results will be incorrect. Simple things can lead to a complex and dangerous consequences if all procedures are not followed exactly. There is no room for mistakes in pathology. A mistake can kill someone, and that someone can be you. The primary duties of a collector: to meet and greet the patient. First impressions are those that last. In the first 7 seconds, a client will make up their mind whether to trust, respect, or cooperate with you. We must be 100% accurate in everything we do 100% of the time. Accurate in identifying the client. Just because a doctor wrote the request form doesn't mean they can't make mistakes. There are many instances of 2 or more patients in the same practice with the same name. Identification includes given name, family name, date of birth, address, and phone number. Some testing requires photo ID, and some require a statutory declaration from a justice of the peace. Confidentiality must be adhered to. All pathology workers sign a confidentiality contract, and to break this is breaking the law. A patient's details can only be discussed in the context of their treatment. A patient is never discussed as a point of interest, even between colleagues in a public area, for example, the tea room. Names must never be used or repeated. If you see a patient out of work, do not discuss the visit with them or any of their family members. This is breach of confidentiality. If a client's family member phones and inquires if the family member is at the pathology practice, we can't give out this information, as this is also breach of confidentiality. No information is to be given out over the phone except to the referring doctor. We must collect the appropriate samples and the correct number of samples. If you're in doubt, look up your test manual. Contact specimen reception. Contact your supervisor, but never forget. Safe and appropriate handling. We're responsible for our own safety, the safety of our patients and co-workers. We must work within the safety guidelines of the practice and not take shortcuts or deviate from documented practice. If we see something that needs fixing, fix it if it's simple. If not, report it to your area supervisor or team leader. We must keep all records accurately. Ensure that we read all memos and updates as required. Pathology is an ever-changing industry that must keep up to date with industry innovations. This means that our documentation is being updated constantly, and we must adhere with the document control regulations of replacing old documentation as required and sending the old documentation back to the originator of the document. If we don't do this, we'll be working to old work instructions. Accuracy of records start with the request form from the doctor. Accuracy in how we check the information on the request, transcribe if required, record additional information that we may require from the patient. Timeliness is imperative. We don't have the luxury of all day to do a collection. We must be able to process our patient in a timely manner to be able to conform to specimen quality. A specimen must be processed in a timely manner to ensure the accuracy of the results. We must be able to meet courier timetables. We must ensure the specimens reach the laboratory to ensure speedy results. We can't keep people waiting all day. When we know our job, we become efficient. If we don't know how to do a procedure or aren't sure of how to do it, ask for help. With the correct training, we become efficient in our job. Never attempt a procedure if you are unsure of how to do it. Know when to call for help and who to call for help. Duty of care. All health workers must exercise duty of care and good standards of clinical care to the public. Experience does not excuse any person from liability. Care should incorporate trust, consideration, and the emotional state of the patient. Our professional relationship with the patient, how we communicate with them, our professionalism, our dress, attitude, efficiency, knowledge, our courtesy and confidentiality, care and understanding, accuracy of identification of the patient, answering questions only within our scope of our position, refer them back to their doctor, seek assistance when you need it, and above all, have patience with patients and their carers.